Nothing is more frustrating for a chronic pain patient than not being able to get their medication when they're due. Today we're going to talk about one of the reasons why this might be the case, and hopefully give you a little bit of advice on what to do to avoid this very important problem. Did you know that there are 2 dates for every C2 prescription? There's the date that the doctor writes the prescription. It's generally the date that you saw the physician, that you had your appointment. And then there's the do not fill until date. That is the date that the doctor is telling your pharmacy when they can fill your medication. So why might this be an issue? What problems might this create? Let me give you a great example. So it's the summertime. A lot of you are going on vacation. People go down the shore, right? In this area, they go down the shore. So let's say you see your physician on the 1st of the month, and you're going on vacation on the 20th of the month. And for some reason, the doctor writes on your prescription, do not fill until the 22nd of the month. Well, I hate to tell you, in that scenario, you're not going to get your medication any earlier than the 22nd of the month, and it's going to interfere with your vacation. This is all due to the way that the regulations are written, that the law is written. Pharmacies can literally not touch that prescription until the 22nd of the month. So if this is the scenario, the only thing that you're going to be able to do is contact your physician and ask him to rewrite that prescription. Nobody wants to do that with their physician. We know why. Their patients are afraid that they're going to cause too much issue for the office, and they don't want to be labeled as somebody that is causing trouble. But in your scenario, it's better to do that than to create a gap in therapy, or perhaps a really big inconvenience, especially when you've done everything you can to be at that doctor's appointment on time. Not to mention, many of the pharmacies cannot even order these controlled substance medications until that do not fill until date is reached. So if it's a C2 prescription like a Percocet, and they don't have that medication in stock until the do not fill date, you're just gonna have to wait another day. Or in some cases, pharmacies don't order these drugs for maybe 2 times a week, which creates even a bigger gap in therapy. So this is all due to the regulatory environment. The opioid epidemic has created heightened awareness of this very problem. And unfortunately, it's impacting patients that have been adherent, they're compliant, they're legitimate, they need these medications, unfortunately. But because of the way the laws are written and the criteria that pharmacies have to follow and doctors have to follow, unfortunately, you're going to be affected. So how can we avoid this? One really important thing that you can do is just make sure you know what that do not fill until date is that's going to be written on that prescription. Ask your doctor and make sure you coordinate that date appropriately. Okay, most doctors are gonna help you. They're gonna do whatever they can to make sure that, if you have a vacation scheduled, that the medications are coordinated that way. And just work with them. Just make sure you're very upfront, be very transparent, and 9 times out of 10, you're going to be able to get your medication on time. If you do that, I almost guarantee you're not going to have any issues going forward. Everybody's going to be very thankful that you were upfront with them, and they're going to do everything they can to make sure that they accommodate you. Hey, look, if you liked this little video here, just give us a like below. Please subscribe to our channel, and if you have any comments, any questions, just interact with us in the comment section below. Looking forward to talking with you, and I hope this has been very helpful.